Hello, everyone. Today, we're going to see a case that underscores the complexity of a diagnosis and managing STEMI in the presence of a rare and challenging coronary artery anomalies. So, this type of condition, although not common, presents a unique set of diagnostic and therapeutic hurdles. These anomalies can significantly affect cardiovascular health, often leading to severe complications such as myocardial ischemia and sudden cardiac death. Our case studies results around a 53-year-old female patient who presented with chest pain, ultimately diagnosed with a STEMI of the right coronary artery. In addition, an accidental finding revealed a left descending arterial artery arising from the right coronary cusp via a separate ostium from the right coronary artery. Through this case, we will explore the diagnosis approach, clinical implications, and management strategies required to navigate these complex cardiovascular conditions. So the story for this patient is a 53-year-old female. She has history of hyperlipidemia and she currently smokes for many years. She arrived to the ED complaining of typical chest pain. Her symptoms consisted of sudden onset that were substernally radiating to the jaw. The pain was present at rest and was accompanied by diaphoresis and nausea. The EKG, as we can see here, it shows an ST elevation of leads 2, 3, and AVF with reciprocal changes of V2 and V3 consistent with an inferior MI. Of course, this patient met criteria for urgent PCI given the diagnosis of STEMI with, of course, elevated troponins. During the intervention, a critical finding of 100% occlusion of the mid-RCA was found. A stent was placed, cannulating the artery 100% flow after the intervention. There was also findings of anatomical configuration, as previously mentioned, of the LAD that was arising from the right coronary cusp from the RCA. This has also additionally pre-pulmonary course of the LAD and a congenital absent left circumflex artery. So the presence of an LAD arising from the right coronary cusp and the absence of a left circumflex artery is an exceedingly rare anomaly, affecting less than 1% of the population. This unusual anatomical introduces significant challenges for both diagnosis and management. In standard STEMI cases, the management typically involves PCI. However, when faced with such anomalies, the approach must be tailored to the unique configuration of the coronary artery. Advanced imaging techniques such as coronary computed tomography or cardiac MRI are essential for acute diagnosis, as traditional tests may not fully capture these anomalies. Long-term management for patients with coronary artery anomalies involves regular follow-up with imaging and stress tests to monitor stent patency and the function of the anomalous artery. Personalized medical therapy is also crucial for managing risk factors and preventing future cardiovascular events. A multidisciplinary approach is vital in these cases. Collaboration among cardiologists, interventional specialists, and imaging experts ensures comprehensive care. Patient education on recognizing symptoms, making lifestyle modifications, and adhering to follow-up is key in improving outcome and survival. In conclusion, this case highlights the complexity of a diagnosis and managing STEMI in the presence of a rare coronary artery anomalies. Through careful diagnostic imaging and tailored management strategy, we can navigate this cardiovascular labyrinth more efficiently. Thank you for your attention, and I look forward for any question or discussion you may have.